New York's Mount Sinai Hospital on Manhattan's Upper East Side said on Monday it was testing a man who traveled to a West African nation where Ebola had been reported. The man, who had a high fever and gastrointestinal symptoms, had been placed in strict isolation and was being screened to determine the cause of his symptoms.
A patient came to Mount Sinai's emergency room in the early morning hours with symptoms of fever and recent travel to a West African country. The patient was promptly isolated and placed in a strict isolation facility at Mount Sinai such that we could protect the patient and also any staff and other patients in the facility and all visitors. Using an abundance of caution, we're going to work carefully with the CDC to make certain that this patient does not have the Ebola virus disease.
The New York patient added to concerns about the often fatal disease after 2 American healthcare workers contracted it in West Africa, where they had traveled to help fight the disease that has killed nearly 900 people since February. Missionary Nancy Wright-Bowl will fly on a medical aircraft from Liberia to be treated by infectious disease specialists in a special isolation ward at Emory University Hospital in Atlanta. Emory specialists on Saturday began treating 33-year-old US Dr. Kent Brantley, who also returned home after being stricken with Ebola during the emergency response to the worst outbreak on record of the virus.